I'm Dr. Dan Stock of PureHealth Functional Family Medicine, and we're here to discuss the Netflix documentary, Take Your Pills. Take Your Pills was a Netflix documentary about the inappropriate and appropriate use of Adderall and stimulant medications in the treatment of people with ADD, and its inappropriate use by people who are trying to gain an edge in making their concentration better. I thought the Netflix documentary was on balance mostly it was very well balanced, although it didn't really leave an alternative treatment for those people who had ADD. It did a very good job of presenting the people who don't have ADD and why they're using this medication and the misinformation that's leading them to use this medication, and the complications that come when you use this medication, both appropriately and inappropriately. I think my disappointment with the video was they didn't really offer any alternatives to these amphetamine stimulants for people who do have ADD. I think one of the things people need to understand when we use any of these class of drugs that actually mimic the neurotransmitters that a brain makes, that we always have a terrible net of side effects that come up with this. Most of them running at a low enough level the patient doesn't know it's doing it, but always there. So if you start off as a normal person whose nervous system is working normally to begin with, the only thing we can do is give you side effects, which is what they actually noticed from the people who were using it. They didn't perform any better. They just thought they were performing better, so they had a misperception of their reality induced. But then if you looked at the people who did have a problem in their neurotransmitter systems, when we gave them these medications, the damaged system would work better, but there would be ramifications in the undamaged systems as they were now being hyperstimulated by these stimulants. Now the hope was always going to be that that would be just such a small amount of side effect they wouldn't notice it was going on, or that on balance they would feel they were better off with the treatment. The one thing I would really have loved to see them do in the documentary was to say, and these are the things that actually make people get attention deficit disorder, that ruin your ability to concentrate, that damage the brain circuitry that Adderall's trying to band-aid, and that these are the things you can do to actually make it so that that broken system is healed and not broken anymore and doesn't need any kind of a band-aid. So Adderall mimics what are called the catecholamine neurotransmitter systems in the body. So if you have a group of catecholamine producing nerve cells that can't make enough catecholamine, then what we do is basically supply catecholamine so that injured circuit will have enough to make it run. That's how it actually helps the attention focusing, because some of the things that we use to block out the sensory part we want to ignore and keep focused on the things we want to pay attention to use catecholamines to make that function occur. The problem is that there are multiple systems of the body using catecholamines, and so we are definitely overdosing all those other systems when we do it. Now, if we keep our doses low enough, we give them just a small enough amount of problem that they can mostly compensate for what we've done to them, while still giving a boost to the guy who's down below there. What the amphetamine stimulants never do is they never fix the injured cell that's having trouble making its own catecholamines. Well, certainly an overdose can be dangerous. As a matter of fact, it's a controlled substance for a reason. Back in the 60s and 70s, people were using it at parties to stay up all night and having incredible elation feelings going on all the time. So among the other circuits that run on catecholamines would be the circuitry that allows us to feel satisfaction when we've done something, get that a job is done feeling occur. It's also used in the systems that run the heart and blood vessels. It's also used in the systems that control appetite. Which is why we see people that take overdoses will have a rapid pulse rate, high blood pressure, they'll have sweating. Basically, they feel like they're exercising or in a threatened situation. They'll also have a decreased appetite because it's involved in that circuitry as well. And so these are the common side effects that you'll see people have with it, is cardiac complications and then problems with appetite reduction. Other things that can be involved in it is anxiety suppression. So these people will get into a hyper alert state. That's usually when you've got somebody overdosed, because now they are just zoned in on one thing and they can't get their mind off of this one thing. And if that one thing is really bothering them and it's something they can't solve, then they just keep dwelling on it. Well, I would tell them, first of all, I'm the servant, so I never tell a patient what to do. But what I can tell them is the very same process that's making that catecholamine cell so they can't function normally in your brain is increasing your risk of dementia, autoimmune disease, hyperimmune disease, reflux disease. It's making you susceptible to infection. Those underlying causes are making you pretty much inflammation sensitive. And so it's what you never see as a person who has just ADD. They always have these other problems as well. And even if I could forever band-aid the symptoms of your ADD with Adderall or whatever medicine I wanted to use, it would not stop that other process from damaging other parts of the body, and eventually other problems will develop. So a lifetime of Adderall probably is never going to be as ideal for any human being as finding out the root causes that made that catecholamine cell sick in the first place, because then you'll not only fix that catecholamine cell, you'll fix a pancreas cell and a liver cell and a heart cell and everything else. I'm Dr. Dan Stock of PureHealth Functional Family Medicine. I have a strong interest in almost all neurologic and immunologic diseases, including ADD and ADHD. And I enjoy nothing more than having a patient so that they can be comfortable and concentrate without the use of any catecholamine stimulants, and preventing all the other diseases that come their way as well. I can be found on the internet at purehealthmed.com, or you can reach me at 317-559-2515.